It's been 5 years since Canada legalized recreational cannabis in 2018. A report released last week analyzing cannabis laws has found the industry, the healthcare sector, and community groups all say the current regulations under which weed is legal are outdated and causing problems. The report outlining the issues, including 40% of the cannabis market still controlled by illicit sellers, there's weighty taxes, a race to the bottom on cannabis prices, and advertising restrictions make it difficult for businesses to match customers with the right products. The report says because of these issues, companies across the supply chain are struggling to realize profits and maintain financial viability. For more, we're joined by cannabis researcher, professor, and director of the Center for Social Innovation at Humber College, Daniel Baer. Professor, what are some consumer patterns we've seen here in Canada since legalization?
Thanks for having me on to answer that. I think one of the important things that we've seen is that the sky has not fallen. A lot of people predicted doom and gloom. That I remember in Parliament, someone predicted that teenagers would be heating up cannabis in toaster ovens. That simply hasn't happened. Around young people, where the most concern about consumption is, we haven't seen any significant increase in consumption nor increases in harms. In fact, I did see some research that showed that young people are far less willing now to get into a car with someone that's consumed cannabis than they were before legalization. A lot of people like to ask the question, has consumption gone up? And it has. It was going up before legalization. It continues to go up. It seemed like there was a small increase in there, but that's not really a statistic that worries me because consumption by itself isn't indicative of a problem. What we know from most of the new consumers is that they're relatively infrequent consumers, and so their risks are quite low overall.
In terms of retail regulations in Canada, is cannabis heavily marketed like alcohol, or does it have more of a public health focus like tobacco?
So legalization took on an explicitly public health approach and instituted very strong regulations on the cannabis market. Frankly, those regulations may be a bit too strong as they're hampering the ability of the market to thrive and attract consumers into it. So we don't see advertisements anywhere where people can be under the age of 19. So for example, at my local movie theater, there's a VIP ticket that you can get where they'll serve you drinks and you can get dinner. And in there, you can see a cannabis advertisement because it's age gated. Anywhere else outside of there, you can't. So we know that the regulations around retail have been quite strict. In Ontario, for example, you'll notice opaque coverings over every retail store. A couple of the other provinces have started doing away with that because those opaque covers lend a bit of seediness to the idea. It's kind of like, why is that one business have an opaque covering when everything else is trying to get you in by showing you their wares, showing you their offerings? And so we're seeing a lot of regulation that may have been intended to support public health, but might be time to be reconsidered in order to make sure that the cannabis market thrives and that consumers are able to get safe and legal products.
And we can't talk about cannabis legalization without addressing the racial and social justice elements that come with it. Has there been a shift in stereotypes associated with the drug since it became legal?
I think we've seen a bit of a shift in stigma around cannabis, though it still persists in many corners. And I think that we're starting to see a bit more acceptance of cannabis, a bit more discussion of it. If you look at the surveys, about 27% of Canadians consumed in the last year. Many people are viewing it quite favorably now. That's helping to normalize it and destigmatize it a bit. However, we need to do more to undo the past harms of cannabis prohibition. We legalized cannabis in a way to create business opportunities and tax revenue, and we didn't take an explicitly social justice approach to this. So, for example, only as of last count at least, only about 464 people who were eligible for a cannabis expungement actually had received one. And depending on who you ask, that population is anywhere between 50,000 and 250,000 people that are eligible. I think it's important to understand that the way in which we talk about cannabis still mirrors a lot of the drug war rhetoric, where use is often identified as problematic no matter what. And one of the things we need to do is better train physicians, frontline healthcare workers, and others who interact with cannabis consumers and who are many times cannabis consumers themselves. We need to better train them how to interact with people, to provide guidance and support, and make sure that people are getting harm reduction and safety related information. So we really need to do more to undo the harms, put money back into communities that were harmed by the war on drugs, and consider those elements of it.
Thank you so much for speaking with us, Professor Baer.
For sure. Thanks for your time. Appreciate it.